Olivia is a 16-year-old high school student. She is the only child of her parents. She suffers from obsessions. These obsessions causes her significant distress and anxiety. Olivia tries to suppress the thoughts by telling her mind repeatedly,
I don't want these thoughts. I don't want these thoughts. I'm not going to think about these thoughts.
sometimes closing her eyes with determination to get rid of the thoughts popping into her mind. Despite her repeated efforts, she is unable to get rid of the thoughts or stop the thoughts from flowing into her mind. Olivia's brain comes up with some ideas of actions she can perform in form of daily rituals to reduce the tension and anxiety that is associated with the obsessive thoughts. Olivia ends up spending 4 to 6 hours daily thinking the thoughts and ending in the mental actions to reduce the tension and anxiety, which never works to stop the thoughts or reduce her distress and anxiety. Olivia's mind is filled with germs covering all things in her room and her hand from touching things in her room. Cleaning her room several times in the morning, and washing her hands repeatedly up to 20 times in the morning for the fear of catching germs. She missed the school bus many mornings.
Olivia, come out, your school bus is waiting.
No, Mom, I am not coming.
She is busy cleaning her room or washing her hands in the morning. The school bus driver, after waiting for a few minutes without seeing Olivia, the school bus driver drives off to school without Olivia. Today in school, she started counting from the time she stepped into the school building. In her mind, Olivia is counting colors of purple and pink in people's clothes, book bags, pictures and artwork hanging on the wall. She missed her classroom in the middle of the hallway, and got to the last classroom at the end of the hallway before she turned back. She arrived late into her classroom because she was busy counting the pink and purple colors. When in the classroom, she continued counting in her mind the pink and purple colors. She was unable to focus on what the teacher was saying in the classroom.
Olivia, can you please answer the question?
Sorry, ma'am, I do not know the answer to the question.
But I just finished teaching you just now.
Sorry, ma'am, my mind was counting my favorite pink and purple colors. I'm unable to stop my mind from doing this, so I could not follow the teaching.
Okay, Olivia, sit down. I will be glad to teach you again during your lunch break.
One day Olivia was in school. She had several bad images and thoughts in her mind that her father met a severe accident.
Ma'am, please, I want to go home. I need to go home and see my father. He is not feeling well.
Oh, how did you learn about your father? I mean, I did not receive any instruction from the school about sending you home.
No, ma'am, I have a bad thought that my father is in a bad accident at work. Please let me go, otherwise I will faint here in your classroom.
Relax, Olivia, there is nothing to worry about. It is your suspicious mind playing tricks on you again. I am sure they are fine, but if you insist, please go home and check on your father. Please note you will be marked absent from school today since it is just 9 o'clock a.m. and you just arrived in school.
She ran out from the school, and eventually got home and clutching her heart as if she has the pain from heart attack and she is about to faint. After reaching home, Olivia's mother was cooking food and her father is watching TV. Olivia saw them and took a deep breath, ran to her father and said,
Oh, thank God you are okay, Father.
Went to the kitchen and see her mother.
What happened, Olivia? You came so early.
Yes, Mum, I ran out from the class because I thought Dad was in a bad accident with his truck damaged beyond repair.
Oh my God, Olivia. I don't know why you always have these negative thoughts. I am very tired of these your thoughts. You missed school many times due to these thoughts. When you get to school, you are not able to focus and concentrate on your studies. You are failed after repeating this grade for the second time. At this rate, you are unlikely to graduate from school.
Olivia appears very sad and said to her mother,
Mom, please help me. What can I do? I have no control of my thoughts.
Olivia ran into her room and locked door, feeling sad. The following day at school,
Teacher asked Olivia. Olivia, what happened to your father yesterday? Is everything okay with him?
After listening to the teacher again, gets worried about her mother at home. She has images of people breaking into their house and shooting her mother.
Oh no, ma'am. I'm so sorry. I want to go home and check on my mother, she is not feeling well. I want to go, please.
And she ran away from school to go home. After getting home, Olivia sees her mother at home, completely relaxed in the living room reading a magazine. After seeing Olivia home early, gets really worried. She knows the reason that Olivia comes home early from school is due to her negative thoughts. She is worried and thinking what to do about helping Olivia. She knows she has to talk to someone who can help Olivia about her negative thought problems. While she was deep in thoughts about what to do for Olivia, her doorbell rang. Olivia's teacher was in the house. Teacher to Olivia's mother.
How are you, ma'am? Olivia said that armed robbers broke into your hazu and you in danger of losing your life because they were firing arms around the house. I was really worried about you, that's why I came here to check up on you.
No, teacher, I'm doing fine. I am very sorry about Olivia's behavior. I am really worried. I don't know why she has all these negative, irrational fears and thoughts. She washes her hands and cleans her room several times in the morning, missing the school bus in the morning on several occasions. In fact, at night, many times she checks the doors and windows several times before sleeping to make sure the door is locked. She also wakes up several times in the middle of the night to check door, just to see if the door or windows are locked or not. In school, she is fascinated with counting things. This causes her to arrive late in classroom. When she gets to the classroom, she is unable to focus in classroom when the teacher is teaching the students in class.
Olivia's teacher after listening to this. The teacher understand about the disease condition that Olivia is suffering from.
Oh, now I understand. Don't you know that Olivia is suffering from a mental health disease named OCD?
OCD? What is OCD?
OCD is Obsessive compulsive disorder. It is a chronic and long-lasting disorder in which a person has uncontrollable, reoccurring thoughts, causing distress and anxiety. She responds by performing ritual acts that he or she feels the urge to perform repeatedly related to the obsessions. This explains most of the odd behavior of Olivia and her failing in school.
Oh, I see. How does it happen, teacher? And now what is the treatment for it? Will Olivia be able to get rid of this illness?
OCD is due to genetic and hereditary factors. Chemical, structural and functional abnormalities in the brain are the cause. The two main treatments are exposure with response prevention therapy, usually a type of therapy that helps you face your fears and obsessive thoughts and prevents the performance of the compulsive acts. Second treatment is medicine, usually a type of antidepressant medicine that can help by altering the balance of chemicals in your brain.
I always thought that with time that Olivia will outgrow these negative thoughts and behavior. Now I completely understand what she is suffering from. But please, teacher, can you help recommend anyone who is an expert in treating this disease condition and provide the help for Olivia that she needs?
It is very important that you schedule an immediate appointment with a psychiatrist who manages OCD with medications. The therapist/psychologist will help manage Olivia's OCD through the proven strategy of exposure and relapse prevention therapy with relaxation.
Thank you so much, teacher.
Now the teacher leaves Olivia's house. Olivia's mother take her to therapist. The therapist provides Olivia exposure with response prevention therapy. This allows Olivia to confront her fears and prevents her from responding with the compulsive behaviors.